Next up, until the pandemic hit, Massachusetts had been making real progress in the opioid crisis. But as nationwide shutdowns set in, overdose deaths began to rise, particularly among people of color. Overall deaths spiked by 4% from 2019 to 2020 in this state, 14% among Hispanic residents, and 64% among black people. And nationally, opioid deaths rose 30% overall, killing 93,000 people in 2020. That's an all-time high. As my next guests highlight in a recent Boston Globe op-ed writing, understandably, COVID-19 has dominated conversations about health for the past year and a half, but the opioid epidemic hasn't gone away. People continue to die from overdoses. It is critical for society to recognize the crisis, understand how secrets and stigma allow it to grow, and marshal resources to continue to battle drug addictions. Joining me to help us in that understanding are the co-authors of the piece, Dr. Kevin Hill, the director of the Division of Addiction Psychiatry at Beth Israel Deaconess Medical Center, and Dr. Ian Halim, a psychiatry resident at Beth Israel. Doctors, it's good to see you both. Thank you for being here.
Thanks for having us.
Dr. Hill, are these incredible increase in numbers more modest on the state level, huge on the national level? Or is that more collateral damage from COVID-19, or is something else going on?
No, absolutely. I think that the COVID issue is at the fore. And as we like to say, it's not COVID or addiction, it's COVID and addiction. And so really the use, the prevalence and deaths related to all substances is on the rise. But the opioid problem is really front and center because those patients are dying every day. And as you mentioned, 93,000 deaths, drug overdose deaths in 2020. 60% of those deaths are directly attributable to fentanyl, the powerful opioid. And in Massachusetts alone, over 2,000 opioid deaths. So that's like wiping out the local high school.
Dr. Halim, the numbers overall are horrible. The numbers among black men are beyond horrible. Why?
So the numbers were already slightly rising prior to COVID. And as we all know, COVID has created a huge amount of additional stress for the American people. We've seen, for example, patients with other substance use problems such as alcohol have also risen. So this is part of a larger pattern.
No, but I meant among black men in particular. That's where the numbers are just astronomical. Why?
That's a good question. I'll let Dr. Hill respond to that.
How about it, Dr. Hill?
Yeah, I think the issue really focuses on the idea that, research has shown that when people of color go into the ER, they're less likely to get the treatment that they're supposed to get. And that's something that we've been working on for years. I like to say that we treat patients from Beacon Hill to Mission Hill, but we have to do better. And I think that it really speaks to the larger issue of people understanding what treatment for opioid use disorder is, and then making it available.
Dr. Halim, in your op-ed that you both wrote, you used the term, as I touched on, stigma and secrecy. I have to say I am surprised that the stigma issue is still as strong as it is. As an observer, I was hopeful that it was dissipating. Apparently it is not.
Yeah, so at the addiction service at Beth Israel, we do find that some opioid users are resistant to the idea of medication-assisted treatment, for example. So this would be one way that this stigma is very visible to us. So that would be medications like methadone and buprenorphine, which can be used to reduce someone's risk of death who has an opioid use disorder.
And why is that, Dr. Halim? Because I think you write that because the notion is that the only path to being sober is a drug-free path. Is that sort of the myth, for lack of better expression, they're buying into?
That's correct.
So, Dr. Hill, there's also the basic sort of ground floor stigma around mental illness. And I'm sort of surprised to read you guys write this, because I've read story after story, which are both horrible and heartening in the same breath, when obituaries, particularly of young people who've died from opioid addictions, where their parents have consciously said, we're not going to shy away from this. We want everybody to know why this kid we loved, this young man or woman we loved, is no longer here. So how deep is this stigma around admitting you have a mental health issue?
So Jim, the obituaries you mentioned are the exceptions, unfortunately, and not the rule. I think it's so much easier for people to talk about really any other kind of medical problem other than addiction, particularly the opioid issue. If you look at the obituaries, and that's something that I've grown to do, unfortunately, as a habit these days, to look for our patients, so many young people die suddenly. And when you read more, the kind of detail that you're talking about isn't shared enough. And that's really the point of the editorial. We want people to feel comfortable to be able to talk about these kind of problems. And as you see, when you're on Instagram, it's so much easier to portray a great lifestyle full of victories when that's not the real story oftentimes.
So Dr. Hill, is it as obvious as the cure is, as tough as it is, being more open and just talking about these issues? Is it as, I don't want to say as simple as that, but is it as direct as that?
That's a great start. I think that's really what we have to accomplish. We have to let people know that we're here. We've got treatment programs like ours and other great ones around the city where we're battling every day side by side with patients against addiction, including opioid use disorder. We're winning some of these battles, but for us to really win the war, we need more people involved.
How do we get more people involved, Dr. Halim? How do you win that war?
Sure. Well, I think that was part of the purpose of the piece, to get more people thinking about the issue, talking about the issue, than what has been the case recently. I mean, there was a great New York Times piece about the new data, the preliminary data from the CDC with these increased overdose deaths. And then there was very little discussion following that piece. And so that's what we're trying to push.
Before you go, Dr. Hill, I may be bringing this in from left field, so feel free to swat it away. We are in this grotesque anti-science era where a significant chunk of the population consciously says, I don't believe in this, and medicine is part of science, addiction treatment is part of science. Is that part of the problem, or is it not?
It is part of the problem. I really believe, as you mentioned earlier, one of the lines that we wrote was about how really the only true recovery in the eyes of many is a recovery that doesn't include any drug at all, including drugs that are prescribed. And that flies in the face of science. We know that these medications are life-saving. So I think that it begins with people like us getting out in the community, educating people so that they know what to look for and what treatment looks like, and making it more comfortable for people to share the problems that they have. And I think that we're doing that, but we're not doing it at the magnitude that we need to. And that's why the trends are moving the way that they are.
Well, you are both welcome anytime to broadcast the message. Dr. Hill, Dr. Halim, thanks for your work and thanks for your time.
Thanks for having us,
Thank you
Jim.
so much.